Thank you for joining us. My name is Stephen Perlin, and I am here at UHS Binghamton General Hospital because today, March 6th, is World Lymphedema Day. Now, what does that mean? Well, lymphedema is the swelling caused by the buildup of lymph fluids in the body between the skin and the muscle. Lymph fluid is a part of the lymph system, which plays a role in your body's ability to fight infection and disease. Today, I'm joined by Bethany Beckwith, one of our lymphedema therapists here at UHS, and she's going to talk to us about the disease and give you a better understanding of what it is. Thank you for joining me, Bethany. Important day, obviously, to be here.
Yes, thank you. I'm so excited for you to be able to share and promote lymphedema awareness today.
Yeah, absolutely. And of course, I mean, there's no better day to do it than World Lymphedema Day. I mean, it's built in just so we could do things like this. But obviously, this is something that people are dealing with regularly. So I wanted to get a little bit more information for our community and our audience. So talk to me about what lymphedema is, how does it develop, and, what people are dealing with there.
Sure. So to start, the lymphatic system is part of your circulatory system. And what it does is there's fluid floating throughout your body, and it acts kind of like waste management of the skin. So it pulls up that water, it pulls up proteins, cellular debris, toxins, and other bacterial from the skin or the deeper tissues. And as it travels up your body, it gets filtered through lymph nodes, and then eventually it returns back to your heart as just pure water. So when there's a breakdown of the lymphatic system, the lymph vessels, the lymph nodes are damaged. It's not able to circulate that fluid as efficiently, and what happens is that the body can accumulate what we call lymphedema.
Okay. Yeah, so obviously you need those the water and everything moving around your body, getting it to where it needs to be. So this is developing. What usually causes something like this? And then what are the signs and symptoms so people are aware?
So there's many causes of lymphedema. The most widely documented and researched cause can be cancer and cancer-related treatments. But it can also be caused by recurrent infections and wounds, venous insufficiency, blood clots, diabetes, and other conditions of the organs that are failing can cause edema. And if edema is not managed, it will eventually become lymphedema. Additionally, sometimes people are born with it or develop primary or congenital lymphedema at an early age. So the signs and symptoms are that it's always asymmetrical swelling. Sorry. So it's asymmetrical swelling that it tends to get worse throughout the day the longer that you're on your feet. It usually affects the legs, but it can affect the arms. It can also affect the chest, abdomen, genitals, as well as the face and neck.
So obviously, I mean, you feel this type of swelling, or you probably notice it pretty frequently, or pretty, right away, or something like that. You want to contact your primary care or one of your providers, obviously, to talk about this, because you want to catch it as soon as possible, I imagine.
Yes, definitely. So actually, here at UHS, we work very closely with our oncology providers, and so any of the UHS patients that have a diagnosis of breast cancer or head and neck cancer automatically get referred to us.
Oh, great.
So we can screen them out right away, give them exercises, and educate them about the signs and symptoms. And if they do start to develop some swelling, then they're on our program and we can start treating it right away.
Oh, that's great. Yeah, so in case it does, because it's obviously not going to develop every time, but this way they're at least educated. They know if, oh my God, I'm getting the swelling, I should probably check in or make sure right away. And now, obviously, when it comes to swelling, a lot of different things can cause swelling, so you have to be obviously a little bit cautious. You want to maybe talk to your primary care if you are concerned about it, but also obviously you're going to be aware of this because most likely you're talking about with your primary care doctor beforehand, or there's something that's leading to this kind of diagnosis, correct?
Yeah, there's a lot of, there would have to be a thorough medical history, and sometimes it is just age degeneration of the lymphatic system and the venous system, which accumulates into edema and can turn into lymphedema.
Okay, and now let's talk about, we're in this great room right now, obviously this very comfortable looking chair. What do we do here at UHS for people who have lymphedema? I know you're obviously a therapist, so you're working with them. Talk to me a little bit about our services and how we help them. My understanding is it's a chronic disease, so we're always going to be helping, but what can we do to make their lives better or get back to their regular life?
So here at UHS, we have 4 occupational therapists who are certified in a protocol called complete decongestive therapy. There's 4 components that we teach our patients how to decongest their affected body part, and then we teach them how to self-manage it. because it is a chronic condition. It's typically lifelong. And what that protocol consists of is thorough skin care. There's a manual manipulation of the skin and swelling to help pull that swelling out of the area. And then we do an application of compression garments, and there's many different types of compression garments. So compression stockings are not always something that somebody is thrilled to hear that they have to wear. So there are alternatives. And then we teach them exercises that they can do with that affected body part to help the muscles push the swelling out.
So, I mean, obviously nobody wants to end up with lymphedema, but it doesn't mean the end of everything. It sounds like it's very manageable. I mean, obviously nobody wants to deal with chronic disease, but you have a team in place and you have ways to make it manageable, to make it a little bit easier to deal with, correct?
Yes, absolutely. And the sooner we can start treating that edema or lymphedema, the easier it is to manage.
Great. Anything else you want to add today, Bethany? I know we got a lot of good information out there for our audience, and I'm very excited that everybody's a little bit more educated. Anything else that we're missing so far?
Well, thank you so much for having me and supporting World Lymphedema Day. If patients want to know more about lymphedema, they can find resources at the National Lymphedema Network. And if there's occupational or physical therapists who are interested in lymphedema, then there's an enormous need for it. So it's always great to get some continuing education, or you can give us a call to learn more too.
Yeah, our teams are always growing. We're getting better to give more service to our patients. So yeah, absolutely. Always happy to add to the team. Thank you very much.
Yes,
I really appreciate your time today. Obviously very important. Today is World Lymphedema Day, and we are happy that we are able to present a little bit more information for you. If you want more information too from UHS about our services, you can head to nyuhs.org. Thanks for joining us today, everybody.
Thank you.